Good morning. Today we're going to talk about mitral regurgitation and the importance of that valve in keeping you from being short of breath and from decompensating. So I want to go through where the mitral valve is and what it means when it leaks backwards and what we might be able to do to try to fix it. So this is the way the heart works. So the heart is a four-chambered organ that's shaped something like this. And it's separated by walls. And like all pumps, the heart chambers are bounded by valves that allow fluid to come in but not go back in the other direction, ideally. So blood returns from your head and from your legs and abdomen into the right atrium. And then it flows through this valve called a tricuspid valve into the right ventricle. That's the bottom right side of the heart. This chamber then pumps blood to the lungs where you breathe. So you're picking up oxygen and you're blowing out carbon dioxide. Then this good oxygenated red blood returns to the heart into the left atrium. There's a theme, right atrium, left atrium. This blood then flows through this all-important mitral valve into the main pumping chamber of the heart, which is the left ventricle. And normally this heart pumps about 55% of its volume with each squeeze. That's called the ejection fraction. Now this blood is squeezed out this way through the aortic valve into the aorta, which is the main artery that goes down the middle of your body. Then this blood goes to the head, to the different parts of the body, then the whole cycle starts again. That's what happens in a cardiac cycle. Now, as I mentioned before, when this chamber squeezes, blood goes out the aortic valve, and this valve, this mitral valve, should close and it should not leak. But in some patients, for many, many different reasons, when this chamber squeezes, some of the blood goes out this way appropriately, while some of the blood leaks back this way inappropriately. That's called mitral regurgitation. Now, why is that important? Well, first of all, it reduces the amount of blood that goes to the body. So your body is not getting enough oxygen and nutrients, so that suffers. But this blood going back then goes back into the lungs and raises the pressure and the blood content of your lungs, which makes you short of breath. So when patients get short of breath because of a valve problem, it's often mitral regurgitation. Now, what can we do about it? And first of all, why does it happen? There are multiple reasons, but there are two broad categories of reasons why mitral regurgitation happens. So the anatomy of the mitral valve is as follows. You have a valve that looks like this, and you got one leaflet called the anterior leaflet, and a second leaflet called the posterior leaflet. So viewed from the side, these valves open and close, you know, like a floppy valve. It's very thin, it's paper thin. It's amazing it stays as well as it does. Now, there are two broad categories. There's functional and structural, or some people like to call it degenerative. Functional mitral regurgitation happens when the valve leaflets are okay. This is fine and that's fine. But the heart itself is bad. Something else is wrong. So this valve is attached to a heart, but if the heart gets big and starts to dilate, for example, then these leaflets can be pulled apart and then leakage can happen that way. But the leaflets themselves are fine. That's called functional. In some patients, if you have, let's say, an infection on the valve, this valve can become really thick. Sometimes you can get a hole in the leaflet. So if the leaflets are bad, but the rest of the heart is not bad, if the leaflets are bad, that's called structural or degenerative. So those are the two broad categories of mitral regurgitation. Now, how do you detect this? When this happens, when you listen carefully, you can hear a murmur. You can also pick this up most reliably on an echocardiogram, which is an ultrasound of the heart.